Great. So it sounds like everyone had very interesting discussions. We're going to have a little time at the end for questions about our presentations, which will be brief, and then any questions that we don't address within our presentations that came up in your small groups, we welcome you to ask those as well. So I'm going to be talking today about how we fit the sex and gender medicine or sex and gender terminology framework into LGBTQI or Two-Spirit, and we'll talk about that a little bit later, health, and how those two concepts work together. I have no relevant disclosures. So we have two main objectives over the next couple of minutes here. The first is to talk about sex and gender terminology, why precise terminology is key to the health of all individuals, not just trans individuals, but all individuals. And then to go over some basic terminology, which is really necessary to have a grasp on before we move on to the next sections of the talk, which is communicating with our trans patients, and then how we improve care for trans patients in the emergency department. So just a very brief walk through history here. The field of sex and gender medicine, which is where sex and gender terminology comes from, came from the field of women's health, which was focused on women's health, the women's health movement, and reproductive rights. In the 1990s and early 2000s, we started learning about sex and gender differences in health and disease. And we had the term sex and gender-based biology, which came into play. In 2010, as we learned more about sex and gender differences, this term sex and gender-based medicine was coined. And the term sex and gender-based health is very closely related, but kind of takes this concept to a broader population level. But today what we're going to focus on is how sex and gender terminology, which is really from sex and gender-based medicine, can be applied and how that can inform our care of LGBTQI individuals. So as I've kind of mentioned already, precise terminology is key when we're talking about sex and gender in order to provide competent clinical care for all individuals, regardless of whether someone identifies into one of the traditional or binary categories. And once we've correctly identified the sex and gender of our patients, we have to think about how sex and gender, whether you're considering a cisgender individual or a transgender individual, how these concepts should apply to clinical care. So how does this make a difference for someone's differential diagnosis? How does this make a difference for their treatment plan, et cetera? It's also key to think about when we're doing research that we're correctly using sex and gender terminology in order to compile evidence that can be later translated into practice. And so once again, talking about inclusivity, which is very, very important. So not just focusing on these binary categories of sex and gender that are the more traditional categories, but allowing a more inclusive approach to our categories of sex and gender in order to really personalize healthcare. So we're going to move on here to some basic terminology around sex and gender. Some of this may be a review for many of you, but I think it's really important that we all start from the same place. And these are key concepts to what we'll talk about with Dr. Moll and Dr. Samuels about communication with trans patients. So sex, as we know, is someone's biologic status, which is based on their DNA. While gender, or we sometimes talk about gender identity, may be rooted in biology, but is eventually shaped by your environment, by your culture, by your experiences. And these are two distinct concepts that we need to keep in mind. And so these are the full definitions. These are kind of it's a mishmash of sources, but some from the NIH, some from the NIH equivalent in Canada, but these are kind of the definitions that we've come up with. Sex is a person's biological status determined by their DNA, while gender is a person's self-representation as man, a woman, or male, female, and we're going to talk about non-binary categories here in just a minute, or how that person is responded to by social institutions, i.e. the hospital, the emergency department. By embracing categories that are not just binary, we can be inclusive of individuals that do not identify into these binary categories, so sexual or gender minorities. This is really key given the large number of trans individuals in the United States. So estimates are about 1.4 million people who identify as trans in the United States. This is likely a gross underestimate. If we think about it, we know that using terms that encompass more than a binary categorization will help us to improve the care of LGBTQI individuals, and will also help us personalize care for the entire population, because we're really honing down on how sex and gender individually affect health. And so here are some more terminology, some more building blocks for you. Female male is, of course, the binary categorization of sex, typically associated with the XX and XY chromosomes. And then intersex is defined as a biologic sex by gonadal, chromosomal, or anatomic characteristics that do not fit into the binary categories. And here's a slide on gender. So woman and man is the binary categories. Someone is defined as transgender if their gender identity does not match the biological sex that they were born with, whereas cisgender is when one's gender identity is consistent with his or her biologic sex. And so in our case that we just did, we had a transgender woman, so someone who's biologically male or XY, but identifies as a woman. And these terms are very important to really get under your belt. When you're communicating with patients in the ED, when you're communicating with staff, your nurses, your techs, who maybe don't feel as comfortable with the terminology and don't quite know how to phrase things. And finally, a couple more terms for you. And this, of course, is not an all-inclusive list of terminology. We have a handout that's going to be online that has more terminology for you. But gender identity, as I mentioned, is a person's sense of themselves as being a man, woman, or another gender. And then LGBTQI, and now we say 2S, which is a recent addition, two-spirit, is a term that broadly refers to individuals who identify as lesbian, gay, bisexual, transgender, queer, and or intersex. And then the two-spirit edition is a newer term that refers to a concept in the Native American culture, to someone who may identify as both a man and a woman, or have male and female identities. I'm going to skip this slide. Dr. Samuel is going to talk to us a lot more about collecting sex and gender data into electronic medical records. And so here are my key references. And at the end of all of our presentations, we'll take some questions.